Hi everyone, good afternoon, and thank you for joining us for our webinar about how EHR Tutor can help you teach clinical simulations. My name is Lauren McNeil, and I'm on the marketing team here at FA Davis, and today I'm joined by Lisa Hauk, who is our clinical simulations editor, as well as Diane Yeager, the founder and creator of EHR Tutor. Before we get started, I do have a few housekeeping announcements. So due to the amount of people we have dialed in today, we have placed everyone's lines on mute to ensure that you all have the best audio quality. But if you have questions at any point during the presentation, you can ask those in the Q&A panel in the bottom right-hand corner of your screen. We'll take questions at the end of the presentation, so anything that you have, feel free to send those in and we'll get your questions answered. But if we're unable to get to your question, or after the presentation a question comes up that you didn't think of during the presentation, you can also send us an email at ehr@fadavis.com, and we're happy to follow up with you after the webinar. And finally, following the webinar, there's going to be a short survey. Just take a minute or two. This is a way for you to tell us what you need, what you're looking for, and how we can help you. It's a great way for you to communicate with us on what you need after this webinar and any review materials that you might need. So let's go ahead and jump in and get started. We're really excited about our partnership with EHR Tutor and being able to finally provide an easy-to-use, customizable, and affordable electronic charting solution that can be utilized to support learning in the classroom, in the sim lab, and in clinical rotations. The flexible EHR Tutor allows the program to easily integrate across the entire nursing curriculum to fit your needs. Because it can really work with any FA Davis text, it can complement one course or it can complement an entire nursing program. However, today we're going to be focusing on how EHR Tutor can help you teach clinical simulations. So here's an overview of what we'll cover today. You're first going to hear from Lisa, and she'll explain more about our brand new simulations textbook by Patricia Dillon and how it can be used in conjunction with EHR Tutor to really enhance learning and also to create that real-world charting experience for your students. Then you're going to hear from Diane, who was a nursing instructor herself for many years, and then she went on to develop EHR Tutor with that experience. She'll share a little bit of her background of EHR Tutor and then go on to guide us through a brief walkthrough to introduce and share a couple of examples of how EHR Tutor can be used to really support that teaching from the Dillon textbook to help bring content to life. And again, following the demo, we'll ask any questions, so just go ahead and write any that you have in the Q&A panel. And I'm going to now turn things over to Lisa to get started.
Good afternoon, everybody. I'm glad to see that we have a full complement of instructors online. I'm delighted because I am excited about the new edition of our clinical simulations text. Clinical simulations for nursing education has been edited by Patricia Dillon, who is a member of the LaSalle University faculty here in Philadelphia. The new edition is coming out in November of 2017. And if you are not already familiar with this product, let me explain first that it is actually composed of two volumes. There is one volume for the participant and there is another volume for the facilitator. The participant, as it says on the slide, we like to say that the participant gets everything that she needs to prepare for and participate and get the most out of clinical simulations in her volume, and the facilitator gets everything she needs to actually set up and run simulations in the most effective way possible. Lauren, you want to give me the control so I can work my way through the slides? Great, thank you.
You got it.
Okay, so if I could figure out how to do it, I will. So the goals for our simulations were to make them consistent and reproducible, and I think we have developed a format that we have used absolutely consistently across all 53 simulations that we provide in this collection. And the reproducibility is the key, because as you are moving cohorts through your clinical simulations, you want to be able to say that you are giving them the same preparation and the same starting points, and you are running the same simulations with them, so that you should be able to reproduce your results pretty faithfully. And as I mentioned, the 53 simulations cover the entire nursing curriculum. I don't know if you can actually read it, but the table of contents starts with assessment, goes through fundamental skills, maternal, newborn, pediatric, adult, gero, trauma, emergency, critical care, psychiatric, and community health. Now, you'll see a heading here called testing. That's because 51 of the simulations that we provide have two components, the participant component and the facilitator component. The two testing simulations, though, have no participant component, so you can use them, as it were, for sort of testing or a sort of walking into SimLab and saying, okay, let's start something completely new and really unexpected. I mean, you can, if you choose, tell your students in that situation what the topic of the simulation is going to be, but if you do, it's up to them to know by this time to do the kind of preparatory work that they've been doing for all the rest all along. So Sims, I think, is pretty obvious to everybody, can be used with high-fidelity mannequins, but also they can be used for live role play in the classroom. You can actually assign the roles and have people interact just as the scripts say. And you can also use simulations to make up for missed clinical time, which obviously is a real benefit. And EHR Tutor allows for the EHR Tutor component allows for the real-time charting of the simulation, because, as Diane will make very clear to you, if you haven't documented, your workflow isn't finished. Clinical simulations in this collection have been validated through their use in the NCSBN National Simulation Survey, the longitudinal study that covered 2 years. That was the basis for the NCSBN, saying that they were comfortable with up to 50% of clinical experience being delivered via clinical simulation. The simulations that you see in this collection, both the content and the format, because they were consistent and reproducible, our simulations were the core of the simulation collections used in that survey. And of course, all the patient charts and a complete selection of activities based on the patient charts and on the nursing process are all included in the EHR Tutor. So let's start by talking about the participant volume, because the ENACTSIL guidelines say, I think quite rightly, that preparation on the part of the participant will assure a better outcome for the clinical simulation for the participant. So what we do first for participants is define learning outcomes in 6 core domains: cognitive, psychomotor, affective, communication, safety, leadership and management, and delegation. We occasionally, as the simulation requires, add another domain, usually only one other. And I happen to remember that I've seen pharmacology and spirituality. Those are specific to the clinical simulations, and they are not applied throughout. So we begin with, in the participant volume, an overview of the problem, and based on the content in the overview of the problem, we ask the participants a series of review questions. This overview of the problem focuses the participants on what they should be pretty sure of before they go into a simulation about the specific topic. So we start with a definition of the problem. We go all the way from pathophysiology, risk factors, assessment, all the way through nursing management, treatment goals, and then we come to the review questions. And you'll see that in the participant volume, we simply ask the question and we expect them to respond. Then we provide also for participants evidence-based guidelines that they might want to review, as well as topics that we think they should review, more general topics that they should review before they go into the simulation itself. And then we in the printed participant volume, because this was developed before we were in partnership with EHR Tutor, we also, in the printed volume, provide client background, admission sheet, hospital provider orders, and the nursing report. And this is what it looks like, these pages look like in the printed book. Fortunately, we now have all of this information contained in charts in EHR Tutor, which is so much more user-friendly and more realistic for use by participants. Then we ask students to do the same 7 preparatory exercises before every clinical simulation that they are getting ready to go into. We ask them to identify the equipment that they need to take care of this patient, the team members who are going to be involved in the care of the patient, the relevant data, the initial focused assessment, the diagnostic test, treatment, nursing diagnoses, and then, of course, we give them references to make sure that we have good grounding in theory. So, so here's an example of a couple of pages of the student prep assignments. You'll see this happens to start with number 2, identify the team members and what their roles are in the care of the patient. So we ask students to fill these out, and you can use these as a way to check on a student's readiness to participate in a simulation, and you can use it actually as a sort of passport to the simulation. I have had instructors tell me that if they don't see these filled out exercises from their students aren't allowed to participate. So the participant volume can be very useful not only to your students to get them focused on the issues that they need to be well aware of before they go into a clinical simulation, but it also acts as a check for you on are they doing the work and are they prepared to get the most out of the simulation. Let's jump now to the facilitator version. The first thing I want to point out is that in the facilitator version, you get everything that the participants get, plus you get the answers. So okay, I thought we had a sample of the page there, but we don't. Suffice it to say that we don't expect you to come up with the answers. We provide the answers for you. We also provide you with a list of the roles that you will have to cast for every simulation, and we, according to an Axel, divide them into participatory and supporting roles, the people who are actually acting as healthcare providers in the simulation, and the supporting roles like spiritual advisors, social workers, family members, etc. For the simulation itself, we give the facilitators the prerequisites that the program should have covered before that particular simulation gets run, along with the setting. Is it in the emergency room? Is it in an urgent care setting? Is it in the regular patient floor, hospital room, whatever? We give you a description of how you should set up the environment and the simulator. Should it be an older should you put a gray wig on the mannequin? Should the mannequin have vomited? Should there be an open wound? Whatever it is, we tell you exactly how you want to set up the environment and the simulator itself, the mannequin. We give you a complete list of the equipment that you have to have in that room in order to make this simulation work. And I have had instructors say to me, the equipment list alone is worth the price of admission because we don't miss anything. If you need a cotton swab, the cotton swabs are on that list. So it is an absolutely comprehensive list for you, along with the medications and the IV therapy that if you're using faux medications, it will tell you which ones that you have to have on hand. Then we give you the simulator settings. We don't try to, we don't program your mannequins for you. The range of mannequins, the ages that are still in use, it's just too much to handle. So what we do instead is give you the clinical data that you will use to pre-program your mannequins. And we give you the simulator settings in according to the scene or the frame that requires each change in the simulator settings. And then, of course, we give you the script. I put script in quotation marks because it tells you what should be happening by time or by cue. It tells you who should be doing it, and it tells you how you should have the mannequin respond. So here's a sample of the simulator settings, and this is not the first page of it, so unfortunately it's continued, but you would have seen right here scene 1 or scene 2 or whatever, and then you have the vital signs that you would be programming in, and information that you would need about the mannequin and how you want things to look or to function. Then here is a sample of how the script is provided. So you see, again, this is a continued, so you don't see the first entry here, but if you go down, it says what the cue is. The facilitator will cue the husband to do something, or and it tells you up here who is doing the action, the right action, which is here. If the patient responds, sometimes the patient does respond, sometimes they don't, or how somebody else does something in response to the change in the patient's status. And then we give you possible problems that we have seen arise when such a simulation was run. So you can sort of be forewarned about what to watch for, and if there is something that you can do to mitigate it as a facilitator, we tell you what that is. As in, facilitator cues the husband enters the room and asks what's going on. So it gives you a way to sort of get the simulation back on track if it has gone awry. This is just more of what the script, in essence, looks like. And then at the end of every scene, we break the simulations into scenes because learning theory tells us that if you try to cover too much all at once, students just freeze. They just don't know how to continue. So we break the simulations into scenes, and after each scene, we provide clinical pauses. Now, again, this is not the first page on which this appears, so it picks up at question 8. But we give a series of clinical pause questions that allow everybody to sort of calm down, refocus, and it allows you as the facilitator to actually elicit information from them by asking these questions that sort of gets everything, either gets it back on track or it supports what has been going well. And here's more script. So just to recap, the simulations, they cover the entire nursing curriculum. You don't have to have high-fidelity mannequins to run simulations. Our simulations can be used as role play. They can be used to substitute for missed clinicals. And now, I think what many of you really have dialed in to hear about is how EHR Tutor supports our clinical simulations. So I'm going to turn the presentation over to Diane by dragging this little thing. And yes, and thank you very much for your attention.
Okay, I think everybody should be able to hear me now. And I'm going to turn on my screen so I can share my screen. So hold on just 1 second. And there it is. Okay, my name is Diane Yeager, and I'm with EHR Tutor. And I would like to talk to you a little bit about how our product can be used with the Dillon book related to simulations and how our product works. So all the patients who have been built into the Dillon book for simulation have also been added to our system. So what I've done is I've put a couple activities in a course called simulation, and I just wanted to show you a little bit about how this works. When Lisa was talking about the fact that you could use their activities in not only simulation lab, but you could also use them in your, for remediation, you can use them for makeup from clinical, people use them in their classroom to be able to do sort of a soft simulation and walk through and do critical thinking with the students as a group. There are a lot of different uses, and one of the things that happens is when you're at the clinical, in a true clinical setting, you don't learn about your patient and chart on paper and have people hand you index cards or sheets of paper with results on them. And so having EHR Tutor going along with your simulations gives the students to have that feeling of reality. So I'm going to show you a little bit how the charts work, and we'll talk from there. I'm going to open up one of the patients. This is actually one of the patients from F.A. Davis, and I'm going to open her chart. When I open her chart, you're going to see that this is her inpatient chart, and just like inpatient charts from the paper world, you have tabs. And when you want to chart, you just go to the area where you want to chart. So if you wanted to write a note, you just go to the notes area and chart. We're on the first page of the chart, which is called Patient Summary. And this is a report that gives us an overview of the patient at the current time. And you'll see, for instance, this patient has had several sets of vital signs. You can see if there's any trends going on. And you can see patients are built with appropriate orders. This patient actually has a complete set of admission orders on her. And we also can see recent labs that would be down at the bottom. So anyway, a good place to start finding out a little bit about your patient, and to also a good place if you were giving reports to get started. As far as the chart goes, you're going to see that we have a header up at the top. If we were going to go through, one of the nice things about this is students can go through and they can read notes that the provider has written. So if you were running a simulation, I know one of the things that the students do before they actually start the simulation is they investigate the patient by going through the chart. And so the students can come in and read any notes that have been written either by providers or other clinicians, such as other nurses or PT, and find out a little bit more about that patient before they get in there and get started. They can go to the results, and they can see all the different types of results that they have. And you can see here we have 2 sets of labs. They can also go to imaging and diagnostic, and if the patient was built with images actually attached to here or findings. They can read that. So you can see this feels very much like the way you gather information in the clinical setting. So it doesn't feel quite so, you know, sometimes when we're adding patients, adding papers for them, they only have 3 sheets of paper and no chart is only 3 pieces of paper long. And so anyway, it's very realistic. They have to actually go looking for the information that they think would be relevant for the patient. So that, again, gives that feeling of reality to it. Once the students have gone in and started taking care of the patients, the nice thing is they can chart everything that they've done. Now, one thing I do want you to notice here is that when we look at these patients, I'm actually in Eastern time right now, so if any of you are in Pacific time, my times may look off, but it looks as though somebody has just resulted these images that are up here at the top. I didn't create it to make it look that way. The patient was built so that the dates are always updating, so that everything looks current that you're using, so that when you're running a simulation, you don't have to say, well, this patient was built 4 years ago. We'll just pretend it's 4 years ago, because you don't have to do that. So anyway, it keeps, if you've ever had to build charts or update charts and chart dates, that is a really big time saving and a really big efficiency. Once the patients are built, you can use them year after year and you don't have to go back and keep updating them unless you need to change your story in some way. Okay, the next thing, if a student would like to come in and write notes, she can go to the notes area, where she would be able to add any narrative notes, and instructors can come back and read these. If the student has done an assessment, you'll see we have an assessment flow sheet. When she comes here, the beauty of EHR Tutor is it's very easy for students to utilize. One of the things that everybody is sort of surprised at is the students really hardly need any training at all on this. Because it's pretty intuitive. If you want to add another assessment, all they have to do is click the new entry button. And when they do that, it adds another column to their flow sheet with their initials and the current date and time, so that then they can go in and start charting their information and then click submit. So I'm just going to go ahead and write a couple things in here. So I'm going to add some information here. This is a complete head-to-toe assessment, including a Glasgow-Coma scale, a Braden scale, a fall scale, and a pain assessment. So it is a pretty good assessment. We're talking a lot about using this within simulation right now, but imagine being in a skills lab and using this for the students for all the skills that they learn also. And they're learning to be in front of a computer at the same time they're trying to learn how to build a rapport and do the skills with the patients. So it's a really great mix, so that the students aren't learning charting as a different skill than the other skills that they're doing, and then trying to marry them. It's all just one seamless workflow that they're doing. So it's a really great tool. Notice that they can chart any of their dressing change. If they put IVs in and drains, they can chart those in real time. And if you think about it, in the clinical setting, it is required that nurses chart in real time, and that doesn't always happen, but that is the requirement. And they actually, at the hospitals, I did 8 years of curriculum development for electronic health record implementations in 3 different hospitals. All 3 of them ran reports to see if the nurses were charting at the time they actually did these activities, or whether they were dating it and then backdating and timing and writing it maybe at the end of the shift. And so they actually will counsel people on that, because it is a requirement that the charting be done in real time. And it's a really hard thing even for a veteran nurse with good charting skills to be able to do. So adding this in for your students at all levels, and not only simulation, is just a great plus for them to be able to start working in that way as they're learning. The MAR, we do have barcode scanning, so if your simulation requires medications to be given, you're going to be able to have the students barcode just like they do at the hospital. It feels just like you're in Cerner or Epic or some of those products that you have out in the real world. The students also can do care plans or read care plans if you've developed one for them to follow throughout your simulation. They can add information to a care plan, and they can also create new nursing diagnoses to add to that. An instructor then, a lot of times in simulation, they go over the charting at the same time they're debriefing. But if you had them do another activity when they went home to develop a care plan on the simulation, you can do that and you can grade it. I just wanted to real quickly show you how you do the grading, because it is one of our features that the clinical instructors love. When people buy this for simulation, and it works, it's great for simulation, the thing that is amazing is their clinical instructors, if they come to training, love it after they start using it because it's so easy to grade. I'm going to actually go in and I'm going to pretend that I'm grading this patient's chart that I did put one entry in. And when I click on View and Grading for my chart, it opens that chart up that I just showed you and just wrote on. It highlights everywhere where I charted as a student. So it's very easy for instructors to go in and see exactly what entries belong to that student so that they can just go through the chart, and as they're doing that, put their notes in the comprehensive note field that we have up at the top, which makes it very easy for the students to see what they've done wrong, right, or what they need to go back and fix. So instructors say that this cut out 25 to 50% of the time of their gradings when they did assignments such as clinical assignments. So anyway, grading is great. Another thing that we have, and since we're talking about simulation, I would really like to at least expose you to it, is we have something called unfolding scenarios that you can use with your simulations. The patients that were built for the Dillon book, and this is one of them, this patient is actually a postpartum hemorrhage. And when I open her chart up, you'll see it looks just like the other chart. The system right now knows I'm an instructor in a student view, and the students are in the chart right now and they're reading about her and she's hemorrhaging, and they go into the simulator and they're doing their assessments and figuring out what to do. The scenes that Lisa talked about, and you'll see we have two different scenes that are happening here. The first one is the provider is going to return a phone call that they made, and then he's going to give them a methergin and a lab order. We can actually drop this order on top of this chart after they call us, which makes it very nice because the instructor doesn't have to sit and type that order in, and she doesn't have to hand them an index card with that order on. It feels just like at the hospital, because as soon as we drop that order in, it is going to show up down at the bottom for the students to be able to see in real time. So that's a real big time saver too. The great thing about this is you use it over and over and over again. You don't have to delete things, you don't have to reset things. The only thing you have to do is just save, if that activity is saved off, you just add it back to the activity for the new group, and it's a matter of just clicking 2 buttons. So it's very, very, very efficient to be able to use. I think I've given you a little bit of an overview of what we have. Again, if you have questions, you can write them in the questions and answer boxes down at the bottom. So let me see here. I'm going to go back and hand my stuff back. Yeah, I think I did that. Okay.
Perfect. Thank you so much, Diane, and thank you to Lisa as well. That was a really excellent overview for everyone on the call today, and we really appreciate you all joining us. We did have a few questions come in that I wanted to announce for the larger group. One of the questions was if this works in LPN programs as well as LPN and nurse practitioner students as well as RN students.
I guess I'll take that. It does work. It's the nursing simulations in the F.A. Davis book are nursing simulations that you can use really at all levels, pretty much. And the charts that we have are charts. And whatever level you're at, we have people working in the hospital at all levels, and it's a chart. It's just a matter of how you use it and what you're going to focus on for those simulations or activities.
Great. Thank you, Diane. And then another question, can EHR Tutor be set up where the student can put in patient information from clinical so they can turn it in for their clinical paperwork?
Yes. The only thing you need to do, and there are warnings on the page for the students, is that there are no names to be put in and no PHI information that goes in. But that's the same as whenever they're in the clinical and they're writing notes on their paper. There should be none of that information on the notes that they take home either. So, so yes, it can be, and this, like I said, it keeps everything in a clinical method rather than going off and starting to go back into a school mode where you're filling out papers. So.
All right. One more question. Can you build your own patient for the pre-built scenarios or edit their demographics to demonstrate variation?
Yes, whenever, we have over 90 patients in here. In the simulation, I think we have from the Dillon book, I think we have like 53 patients from that book in here. And if you want to tweak something, like maybe there's an order for a medication, but at your hospital they don't use that med very often, but they use another one, you can go and actually make a copy of the original chart as an instructor, delete the orders that you don't want, and then you can add back orders that you do want, or you can change ages. Anything that's in that chart, once you make a copy of it, you can tweak and make it customized to tell the story that you want to.
Perfect. And then last question, is EHR Tutor HIPAA and FERRPA compliant?
Okay, for all of our websites, I'm trying to see, I'm in the wrong website right now. I'm not website, I'm in the wrong browser. If we were in Chrome right now, we would see HTTPS, which means that our site is encrypted. Now, if you're looking for true HIPAA compliance as they need it in a clinical setting, that is at a very different level than an academic program would be looking for. But for the encryption of it, the security of it related to how the information is being delivered from one source into the servers, it is encrypted through there. And again, even though we have encryption, no PHI should come out of the hospital. And it's been that way forever. So there should be no real identifiers in here.
All right, perfect. Thank you, Diane. So thank you all for joining us today on this call. If you have any other questions that come up after the webinar, we can certainly address those. And I did see another question come in about when the new edition of Dillon is publishing, and that will be out this October. So there's a survey that's going to pop up following this event, and that's where you can fill out if you'd like to see sample simulations from the new Dillon textbook, if you'd like a closer walkthrough of EHR Tutor, to see how it would really work in your program. We're happy to do that with you as well. So make sure to fill that out so we know what you need and how we can follow up with you.
Lauren, can I just interrupt just for a moment? The new edition of Dillon is coming out in November.
Oh, sorry, November. One more month to wait. Thank you, Lisa.
Sure.
All right, perfect. So that looks like all the questions. And again, we're here to help and make everything as easy as possible for you. So any questions that come up, feel free to follow up with us at ehr@fadavis.com. And myself, Lisa, or Diane will be happy to follow up with you. So thanks again for joining us, and have a great rest of your day.
Thanks so much, everybody.